Good evening. This is Freeholder Director Sylvia Patillo, and I would like to begin this meeting with a statement. Due to public health issues arising from the coronavirus, the Sussex County Board of Chosen Freeholders are meeting today, Wednesday, April 22nd at 4:30 p.m., remotely via a conference call. The public is invited to listen and will have an opportunity to make comments by calling 973-310-7191. Also, due to the health crisis, the Board of Chosen Freeholders will not schedule travel meetings at this time and will reconsider perhaps in the future. Terry, could you please, I'd like to open this meeting, and Terry, would you please call the roll?
Yes, I will. Freeholder Fantasia.
Here.
Freeholder Fasano.
Here.
Freeholder Hertzberg.
Here.
Freeholder Director Patillo.
Here.
Freeholder Yardley.
Here.
Thank you.
Okay, as we have a moment of silence, I would ask that you would include John Tomasula's family in your thoughts this evening and all the precious lives lost in this pandemic. Please stand with me for a moment of silence and salute to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, with liberty and justice for all. Pursuant to the Open Public Meetings Act, Chapter 231, PL 1975, adequate notice as defined by Section 3D of Chapter 231, PL 1975 has been made by regular mail. Such notice being submitted on April 8, 2020 from the Administrative Center of the County of Sussex, located at 1 Spring Street, Newton, New Jersey, to the following: New Jersey Herald, New Jersey Sunday Herald, Star Ledger, WSUS Radio, and WNNJ Radio, and is also posted on the bulletin board maintained in the Administrative Center for Public Announcements and has been submitted to the Sussex County Clerk in compliance with said act. Before I ask for a motion to approve the agenda, I would like to mention that Resolution 14A will be pulled at the request of SCUMA this evening. So could I have a motion to approve the agenda as amended?
So moved. Fantasia.
Have a second?
Second, Hertzberg.
Okay. All in favor, please signify by saying aye.
Aye.
Aye. Aye.
Okay. We're going to begin with proclamations. Our first proclamation will be recognizing Eagle Scout Christopher Beckert and Freeholder Fasano. Would you please read that proclamation?
Sure, and good evening, everyone. Thank you all for being here, and I have the honor of reading our first proclamation of the evening for Mr. Christopher Beckert, so I will start. Whereas Christopher Beckert, a member of Boy Scouts of America Troop 88 in Hopatcong, New Jersey, has earned Scouting's highest rank and has the distinguished honor of earning 21 merit badges throughout his Scouting career. And whereas Christopher is currently a senior at Lenape Valley Regional High School and is an active volunteer at Morristown Memorial Hospital, the E. Louise Childs Public Library, and Habitat for Humanity. Christopher also enjoys soccer, shooting pool, and cars. And whereas Christopher's Eagle Leadership Project involved building a beautiful sitting area outside the Louise Childs branch of the Sussex County Library in Stanhope, New Jersey. Thanks to Christopher's hard work, the community has a nice bench to sit on and read a book on a beautiful day. Now therefore be it resolved that the members of the Sussex County Board of Chosen Freeholders trust the Scout oath and law will continue to reinforce Christopher's ideals and contribute to his exemplary code of conduct as an adult. Be it further resolved that the Board of Chosen Freeholders of County of Sussex wish Christopher Beckert continued good scouting and success in life. By the order of the Board of Chosen Freeholders, Sylvia Patillo, Freeholder Director, Dawn Fantasia, Deputy Director, Anthony Fasano, Josh Hertzberg, and Herb Yardley as Freeholders. Thank you.
Thank you, Anthony. Our second proclamation is May is Older Americans Month. And Freeholder Herb Yardley, would you please read that proclamation for us?
Thank you. Whereas Sussex County is a community that includes a growing number of older Americans who make countless contributions to our community every day, and whereas Sussex County is a stronger when people of all ages, abilities, and backgrounds are included and encouraged to make their mark, and whereas Sussex County recognizes the importance of physical, mental, social, and emotional well-being of its citizens, and whereas Sussex County can support our community members by promoting independence, inclusion, and participation, engaged older adults through education, recreation, and service, and connecting people with opportunities to share their time, experience, and talents. Now, therefore, be it resolved that the Board of Chosen Freeholders does hereby proclaim the month of May 2020 to be Older Americans Month. We urge every resident to recognize older Americans and the people who support them as essential members of our community. By the order of the Board of Chosen Freeholders, Sylvia Patillo, Director; Dawn Fantasia, Deputy Director; Anthony Pisano, Josh Hertzberg, Herb Yardley, Freeholders. Thank you.
Thank you very much. Our third proclamation is recognizing Julia Dewayne Quinlan for her 40 years of serving Sussex County, and that will be read by Freeholder Deputy Director Dawn Fantasia.
Thank you, Sylvia, and good evening, everybody. A bit of background on this proclamation. In 1980, Julia and Joseph Quinlan founded the Karen Ann Quinlan Hospice in loving memory of their daughter. The personal connection between the organization and the people in the community has been the cornerstone of its growth and development. Their legal battle for their daughter's right to live without extraordinary means of life support and landmark court decision that followed opened the Quinlan's eyes as to the need for end-of-life care for patients. This awareness led to the creation of the Karen Ann Quinlan Hospice that now serves patients and families in New Jersey and Pennsylvania. Julia and Joe Quinlan took their own personal tragedy and transformed it into a way to help other people. Determined to see that treatments, rights, and wishes of terminally ill patients and their families be respected, they opened the hospice on April 15, 1980, leading the nation and pioneering hospice care. They pledged through the Memorial Foundation in 1980 to never turn a patient away because of inability to pay. That pledge has held throughout the years and has been sustained with fundraising efforts and the steadfast support of individuals, groups, and businesses that have generously embraced the mission.
Here.
So for the proclamation, whereas Julia Dewayne Quinlan is chairwoman of the Karen Ann Quinlan Memorial Board and chief executive officer, co-founder of Karen Ann Quinlan Hospice. Together with her late husband, Joseph T. Quinlan, she opened the hospice in 1980 in loving memory of their daughter, Karen Ann. Since the opening, Julia has selflessly dedicated herself to ensuring dignified, comforting care for the terminally ill patients and their families. And whereas during her 40 years of involvement with hospice, Julia Quinlan has been a national speaker who has contributed to the advancement of the hospice philosophy and to the cause of patient rights. Julia is well known locally and nationally and has spoken at conferences across the country on ethics, end-of-life care. And whereas Julia has received numerous awards for her advocacy on behalf of hospice, including the prestigious Jefferson Award, founded 47 years ago by Jacqueline Kennedy Onassis and Senator Robert Taft Jr., this award celebrates ordinary citizens who demonstrate extraordinary acts in public service. The Jefferson Award Foundation recognizes this honor as the Nobel Prize for Public Service. And whereas Julia is the co-author of Karen Ann, Doubleday Publisher, 1976, and the author of My Joy, My Sorrow, St. Anthony Messenger Press, which was released in July of 2005. Her current book, Legacy of Love, is available for order and will be released later this year. And whereas her life as a wife and mother has been quite normal up until the fateful night the Quinlans received a phone call at 2 a.m. advising them that their daughter Karen Ann was in a coma. From that time forward, Julia Quinlan has tirelessly dedicated herself to the cause of hospice and making sure the terminally ill had the care they needed by forming the Karen Ann Quinlan Memorial Foundation. And then on April 15, 1980, the Center of Hope Hospice, now named Karen Ann Quinlan Hospice, opened its doors to Sussex County and the surrounding community. And whereas to this day, Julia plays an active role in the foundation and the hospice, serving as CEO, chairwoman of the foundation's governing board, and the Home for Hospice. When asked what keeps her going, Julia replied, "There's still work to be done and families to be helped. I have plans to expand our services in Pennsylvania and add new programs to what we currently offer. And I may still have another book to write." Now, therefore, be it resolved that the Sussex County Board of Chosen Freeholders hereby recognize and honor Julia Quinlan's commitment and dedication to serving the entire Sussex County community over the past 40 years. By order of the Board of Chosen Freeholders, Sylvia Patillo, Freeholder Director, Dawn Fantasia, Freeholder Deputy Director, and Anthony Fasano, Josh Hertzberg, and Herb Yardley, Freeholders.
Thank you very much. Before we go on, I would just ask that you are part of this call. Would you please put your phone on mute unless you're speaking so we can all hear clearly? Thank you. At this moment, can I have a motion to adopt the proclamations, please?
So moved, Fantasia.
Dawn, can I have a second?
Second, Hertzberg.
Is there any discussion? All in favor, please signify by saying aye.
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 Okay, we're good. We're going to move on to public hearings. A final adoption ordinance 20-02, bond ordinance providing for various 2020 capital improvements by and in the County of Sussex, State of New Jersey, appropriating $14,811,465, therefore, including grants in the amount of $5,971,768, and authorizing $7,705,000 bonds or notes of the county to finance part of the cost thereof. At our regular meeting held on April 8, 2020, we introduced for first reading the following ordinance, which was advertised in the New Jersey Herald issue of April 12, 2020, together with a notice of public hearing stating it would be held at this meeting at 4:30 p.m. Now, before we open to the public, I would like to read to the public and explain how we will handle their comment. We are asking callers who want to make a comment to first state their name and municipality slowly. Then the clerk will create a roster and she will go back and call each person in the order received. Comments are limited to 3 minutes or less. May I have a motion so that we can open to the public hearing?
So moved, Fantasia.
Second?
Second, Hertzberg.
Second, Anthony.
Thank you. All in favor, please signify by saying aye.
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 Opposed? Abstentions? Okay. Is anyone present from the people that have called in to be heard regarding this resolution? If so, could you just say your name and municipality slowly? Okay, not hearing anyone, can I?
I'm trying to unmute everyone.
Yeah, this is a whole nother ball game doing this. Huh? You're on ticket? For who? No, I don't know.
Brother.
If you're not speaking in this meeting, please put your phones on mute.
Lauren Collier, Sparta.
Okay, is there anyone else? Who's next?
Just put me on the scrap piece of paper.
Please put your phones on mute. There is someone that still has their phone line open and you can't hear. Thank you. Still open. There's someone on this conference call that has their line open and it's very disturbing. Could you please put your phones on mute? Okay, that's better. Is there anyone other than Lauren? All right, Lauren, if you would like to speak, please speak. Still on mute.
Thank you, Board of Freeholders. Sorry about the background noise. I'm not sure if you can hear me, but not from my line. I don't know. But thank you so much for calling the public hearing. I was just calling to ask.
Lauren, hold on just a minute, please. Let me try it one more time. Could I please have the attention of everyone that is on this call? Someone's phone is open, and we need you to put your phone on mute. Thank you. Lauren, please go ahead.
Thank you. And thank you for calling this meeting today. I wanted to follow up with the Board of Freeholders if you have had any response from the governor's office regarding the situation at the Andover Subacute Nursing Home. And if so, what has been the response? And if not, what would you like your constituents to do to help in this effort? Thank you.
Lauren, right now we're speaking on the ordinance that I just read. And public comment.
About that.
Yeah, let me explain this for people that are on, because it can be challenging, especially on a conference call situation. We are going through the adoption of a few ordinances. Then we will have a public comment period for anything that is listed on the agenda. And at the end of the meeting, we have another public comment period for anything you want to talk about, Lauren, and that would be the time to talk about that, okay? So, right, that's okay. It's difficult at best trying to work this way, and we appreciate that you're on the call. And I will announce that every time we get to a public comment so you feel comfortable as to what you can speak about at that time. But I promise you at the end of the meeting, you'll be able to speak about everything that you're on this call to ask about, okay?
Thank you.
Is there anyone else that would like to speak on this ordinance? Okay, not hearing any. Could I please have a motion from the board to close the public hearing?
So moved, Fantasia.
A second?
Second, Anthony.
Second, Hertzberg.
Okay. All in favor, please signify by saying aye.
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 Now I have a motion that this ordinance, I need a motion for this ordinance to be finally adopted and authorize the clerk to advertise this ordinance as finally adopted and also post same on the bulletin board in the lobby of the County Administrative Center. So can I have a motion to finally adopt this ordinance?
Hertzberg, so moved.
Thank you. Second?
Fantasia, second.
Thank you. Is there any discussion? Okay, not hearing any. Terry, can I have a roll call, please?
Freeholder Fantasia,
Yes.
Freeholder Fasano,
Yes.
Freeholder Hertzberg,
Yes.
Freeholder Director Patillo,
Yes.
Freeholder Yardley. Freeholder Yardley, can you hear me?
She muted. Okay. We have enough votes to pass, Terry. Is that correct?
Yes, you do.
Okay, then let's move on. B is final adoption of Ordinance 20-03, bond ordinance providing for capital improvements to the Sussex County Technical School located within the County of Sussex, State of New Jersey, appropriating $895,000 therefore and authorizing the issuance of $895,000 of bonds or notes of the County of Sussex, State of New Jersey for financing of such appropriation. At our regular meeting held on April 8th, 2020, we introduced for first reading the following ordinance, which was advertised in the New Jersey Herald issue of April 12th, 2020, together with a notice of public hearing stating it would be held at this meeting at 4:30 p.m. At this time, could I please have a motion so that we can open for public hearing on this ordinance only?
So moved,
So
Fantasia.
moved, Hertzberg. Second,
Okay.
Hertzberg.
All in favor, please.
Yardley,
Say aye.
can you hear me?
Yeah, we
Yes,
have you
we
now.
can hear you
Yes,
now. Thank
All
you.
right.
we have you now. Thank you. At this time, is there anyone on this conference call who would like to be heard regarding this resolution, this ordinance? Okay, not hearing any, could I please have a motion to bring it back and close the public hearing?
So moved, Fantasia.
Second?
Second, Hertzberg.
Second, Anthony.
Okay, thank you. All in favor, please signify by saying aye.
Aye. Aye.
Okay. I am looking now for a motion that this ordinance be finally adopted and authorize the clerk to advertise this ordinance as finally adopted and also post same on the bulletin board in the lobby of the County Administrative Center. So can I please have a motion to finally adopt this ordinance?
So moved, Anthony.
Thank you.
Second, Yardley.
Is there a discussion? Terry, a roll call, please.
Freeholder Fantasia,
Yes.
Freeholder Fasano,
Yes.
Freeholder Hertzberg,
Yes.
Freeholder Director Patillo,
Yes.
Freeholder Yardley.
Yes.
Thank you. Now we're on C, final adoption for ordinance 20-04. Bond ordinance providing for the undertaking of 2020 capital improvements at and for certain facilities of Sussex County Community College located within the County of Sussex, State of New Jersey, appropriating $2,800,000, therefore, and authorizing the issuance of $2,800,000 bonds or notes of the County of Sussex, State of New Jersey, for financing such appropriation, the principal of and interest on the aggregate principal amount of which will be entitled to state aid, pursuant to Chapter 12 of the laws of New Jersey of 1971. At our regular meeting held on April 8, 2020, we introduced for first reading the following ordinance, which was advertised in the New Jersey Herald issue of April 12, 2020, together with a notice of public hearing stating it would be held at this meeting at 4:30 p.m. May I please have a motion to open up for a public hearing?
So moved, Fantasia.
Second, Anthony.
Thank you. All in favor, please signify by saying aye.
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 All right, at this time, we are open up to the public for a comment on this resolution. Is there anyone on this conference call that would like to speak on this ordinance? Not hearing any, could I have a motion to bring the public hearing? Oh, wait, is there someone up on there?
Yes, somebody isn't muted clearly.
I
Okay.
have a question.
Okay.
You
I
have
just
to,
wasn't
excuse
sure.
me. No, one moment, speaker. You first have to identify yourself, and then I will call you in order of other callers. What is your
Well,
name?
That's very nice. I just wanted to make sure you heard me first because I wasn't sure if
Okay.
I connected. My name's Michelle Van Allen. I live in Hardiston Township. I just wanted some clarification as to what those capital improvements were going to be at the college.
Okay, hold on just a minute. Let me get my information.
Thank you.
I have them in my office. You want to go get them? Let me go get them.
Sylvia, do you want me to speak on that? This is Elka.
Do you have it with you? Yeah, please, Elka. I left my things in the office and we made a switch and I didn't bring it with me.
No problem. So
Thank you.
Sussex County Community College is requesting funds for paving, classroom upgrades with furniture, restroom upgrades, new program equipment, deferred maintenance, safety, fire protection, and security equipment, with safety, fire protection, and security technology and technology upgrades, as well as funds for deferred maintenance at the Public Safety Training Academy. And half of the $2.8 million is funded by the state of New Jersey.
I'm sorry, how much is funded by the state of New Jersey?
Half of that.
Half of that.
Yes. Mm-hmm.
Okay, and the rest is coming from taxpayer dollars. And with prior to the pandemic, how was how is the enrollment at the school? How was it, I should say?
I don't have that answer for you. I don't know that it was affected at all. I just do know that they made sure that everything was being done by social media so that the children would not lose any credit or any courses.
Okay.
Prior,
of course
if I may speak, this is
ahead.
Freeholder Fantasia. To let you know, by way of enrollment prior to the pandemic, enrollment was actually staying steady. It initially was anticipated to be falling flatter. As you recall, they did introduce the sports program with the introduction of the football team. That gave a bit of a boost to the enrollment, so the enrollment actually stayed level, was the last report that I received from our quarterly meeting prior to the pandemic situation.
Okay, and of course we have no idea or way of even knowing what's going to happen in the fall, but when these capital improvements are going to be taking place no matter what, even if the school does not open in the fall. Is that correct?
I have no.
As far as, I'm
Go ahead,
sorry, Sylvia.
please. You can take it.
As far as planned improvements there, we have received no updates. Obviously, the state is waiting on the direction of the governor. Everything is somewhat fluid in many sectors. So at this point, we're proceeding forward. So we do have the funding in place to do the projects, with the intention to move forward, and the governor will dictate what can be done and when.
Okay, so it's being set aside. It should and when it happens.
You can put the news on if you want.
Correct.
All right, thank you
I'll put it on
for the clarification.
Thank you very much. Right now, I'm having a lot of static and a lot of on this site. Please put your phones on mute so we can all hear what's being said. Is there anyone else that would like to speak? All right, not hearing any. Can I please have a motion to close the public hearing?
So moved, Fantasia.
Okay, all in
Second,
favor, please
Hertzberg.
signify. All in favor, please signify by saying aye.
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 All right, this ordinance I'm sorry. I need a motion for this ordinance to be finally adopted and authorize the clerk to advertise this ordinance as finally adopted and also post same on the bulletin board in the lobby of the county and administrative center. Can I please have a motion to adopt this ordinance?
So moved, Fantasia.
Second?
Yardley, second.
Second.
Okay. Is there any discussion? Terry, can we have a roll call, please?
Freeholder Fantasia?
Yes.
Freeholder Fasano?
Yes.
Freeholder Hertzberg?
Yes.
Freeholder Director Patillo?
Yes.
Freeholder Yardley?
Yes.
Okay. We are on D, final adoption of ordinance 20-05, and this is our last one for the evening. Bond ordinance providing for the undertaking of a portion of the 2020 road resurfacing program by and in the county of Sussex, state of New Jersey, reappropriating excess bond proceeds in the amount of $2,330,321.56 to provide for the cost thereof. At a regular meeting held on March 25th, 2020, we introduced for first reading the following ordinance, which was advertised in the New Jersey Herald issue of April 12, 2020, together with a notice of public hearing stating it would be held at this meeting at 4:30 p.m. May I have a motion to open the meeting to the public, please?
So moved, Fantasia.
Second?
Second,
Anthony.
Hertzberg.
Thank you. All in favor, please signify by saying aye.
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 Is there anyone present who called into this meeting that would like to speak on this ordinance? Please give us your name and your municipality.
Yeah,
All right, not hearing any. Could I have a motion to bring this back and close the session?
So moved, Fantasia.
Second, Anthony.
Hertzberg.
Okay, all in favor, please signify by saying aye.
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 Okay. I need a motion for this ordinance to be finally adopted and authorize the clerk to advertise this ordinance as finally adopted and also post same on the bulletin board in the lobby of the County Administrative Center. May I please have a motion for adoption?
So moved,
So moved,
Fantasia.
Hertzberg.
Okay. So it was moved by Dawn Fantasia and second by Josh Hertzberg?
Correct.
Yes.
Correct? Okay. Is there any discussion? Terry, a roll call vote, please.
Freeholder Fantasia,
Yes.
Freeholder Fasano,
Yes.
Freeholder Hertzberg,
Yes.
Freeholder Director Patillo,
Yes.
Freeholder Yardley.
Yes.
Okay. Now, this is the first public session from the floor, and this is for questions about the agenda that we have this evening. There will be another public session at the end of the meeting for anything else you'd like to speak about. Now, before we open the hearing, we are asking the callers wanting to make a comment to first state your name and your municipality, and then the clerk will create a roster, and she will call each in the order received. Comments are limited to 3 minutes or less and must only address issues regarding agenda items at this time. May I have a motion to open the floor for public comment?
So moved, Fantasia.
Second? Do I have a second?
Hertzberg.
Anthony.
Okay, all in favor, please signify by saying aye.
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 All right, at this time, if you would like to speak, could you please give us your name and your municipality, and we'll make a roster, and then we will call you so that you can speak, please.
Linda Gianni, Andover Township.
Okay. Is there anyone else? Anyone else who would like to speak on agenda items?
Yeah, I'm sorry, ma'am. I didn't catch the beginning of the meeting. Is the nursing home issue on the agenda?
No, that would be at the last public hearing, public comment period, which would be at the end of the agenda.
Okay, well, I'll wait for that then.
Okay, thank you very much.
You're
Linda, you
welcome.
seem to be the only speaker. Linda Gianni from Andover, so would you please ask your question?
On Resolution B, use of Storm Recovery Trust Fund for Coronavirus Mitigation, will there be details on what that is going to be? And also, will that entail testing in Sussex County so that people don't have to go to Morris County or Warren County?
Are you talking about testing?
Well, I'm talking about
How that money's going to be used?
coronavirus mitigation.
Mhm.
Is there going to be details of what that is?
Elka, could you please answer that?
Sure, that is any expenses that the county is incurring related to COVID-19. The state of New Jersey has allowed us to use our storm recovery trust for those expenses. The details would be governed by OEM and the public health nursing and whatever expenses that they are incurring. We don't have specific details of what those funds are going to be used for, only that we can use those funds for COVID-19 expenses.
Okay, so you don't know if it's going to be used for testing in the county or not?
If there is testing, it would be covered under this resolution.
Linda, can I just interject and say something? That we do not have a testing site in Sussex County, not because we don't have the money. We have been trying to open up a site in Sussex County since the crisis began. What happened is there was a shortage of testing kits and there was a shortage of PPE gear and resources. The reason we went with Morris County is because they had enough testing kits at the time to open up for us, and we were able to partner with them. Many of the counties are partnering with each other because it just makes it easier to get the resources. So now we have Morris County open for our residents to get tested. We are still currently in open discussions with another health provider, and we're very hopeful that these discussions will be successful. And if they are, we would have a site open in Sussex County as soon as possible. So it had nothing to do with money. It had to do with the lack of resources available. But it is our priority. Okay?
All right, thank you. That answered it clearly. Thank you.
Okay. Is there anyone else who would like to speak on the agenda? That was actually off the agenda. Oh, no, the finance. Okay, we're okay. No, not hearing any. Could I have a motion to bring it back to the board and close the public hearing?
So moved, Fantasia.
Okay. All in favor, please signify by saying aye.
Aye.
Right. At this time, I would like to open up to the freeholder comments, and I would like to begin with freeholder Anthony Pisano, please.
Sylvia, I'm sorry, this is Freeholder Fantasia. Before that happens, Thor, is there a way to mute all phones except the freeholders at this point, since we're not open to public session? There still is a phone open, causing a ton of back noise.
I know. Please check and see if you have muted your phone, because there is a phone that's on an open line right now. And it's hard for people to hear. So
this is a member of the public. Too many freeholders have theirs on mute also. I'm hearing 2, 3 freeholders talking at one time. You also need to mute your phone when you're not talking, because the public cannot hear. It's not the public, it's the freeholders. Thank you.
Right. Okay, thank you very much. Freeholder Anthony Pisano, please.
Thank you, Sylvia, and thanks to all who have joined us virtually for this meeting. I know we've been having some difficulties, but I do appreciate you bearing with us. As we all know, this has been a very difficult few weeks for Sussex County. The tragic loss of life at Andover Subacute and Rehabilitation Center is truly nothing less than heartbreaking. My prayers and condolences are with the families of those impacted at this time, and this situation has been extremely concerning. And I feel that staff and residents in that facility and their families must know that everything possible is being done to keep them safe. Sussex County is committed to that. This situation is still fluid, and I understand that we'll be briefed on it later this evening, but I've already been made aware of some of the involvement Sussex County's Division of Health has had at this facility, which includes reporting an outbreak of this virus within the facility to the State Department of Health, as they should have done in late March. That was followed by multiple complaints.
The other jar of sauce up? I wasn't sure if you wanted like your rice or anything.
Sure.
Okay.
We can hear about your rice and
sauce,
sir.
Just heat that in the microwave.
Whoever's speaking about the microwave, mute your phone, please. We can overhear your conversation.
Thank you. As I was saying, that was followed by multiple complaints filed from the county to the state, and additionally communicating with the state ombudsman's office and advising the Sussex County prosecutor of allegations in the week that followed as well. And I've also been made aware of multiple deliveries of supplies to this facility by the Sussex County Sheriff's Office of Emergency Management. I'm grateful for the work of our staff and their commitment toward all of our residents in long-term care facilities throughout Sussex County. And the governor has asserted that now is the time to clean up these systemic problems in these facilities, and I agree with him 100%. But I also want to make sure we figure out why pleas for help went unanswered, and that we prevent this tragic situation from ever happening again. I think the people who call that facility home and the people who call this county home deserve nothing less. COVID-19 remains an ongoing battle in Sussex County, as it is throughout the entire state. And as of yesterday's press release, Sussex County has 735 confirmed cases of COVID-19 and 64 confirmed deaths. I believe our shared focus, as was stated before by Sylvia, has been on testing. Last week, Sussex County announced a true partnership with Morris County, which opened the testing site at the County College of Morris to Sussex County residents who have a prescription from a doctor or a medical provider to sign up for an appointment. Additionally, today, the New Jersey Office of Emergency Services announced that their testing sites in Bergen County and in Monmouth County will now conduct testing on any New Jersey resident, regardless of their symptom status. And those are great resources for our residents for sure, but our focus has been gathering the supplies and resources necessary for Sussex County to have a testing site of its own. That has not changed, and despite the tremendous demand for supplies and other challenges the county is facing, that is our mission, and I feel as though we're making progress on it, as Sylvia alluded to. For our business community, I first wanted to make you aware of the tremendous help being offered by the Sussex County Chamber of Commerce. They're a great resource. They offer tremendous assistance, and I encourage you to reach out to them. I also wanted to make you aware of an important survey for Sussex County businesses being coordinated by the Sussex County Economic Development Partnership to gauge how our local businesses are being impacted by COVID-19. It's a really short and really easy survey, and it will be available until Monday, April 27th at 5 p.m. So please contact the Chamber of Commerce or the Economic Development Partnership for both their resources and to take that important study. I've also asked the Freeholder Director to consider asking for the results of that study to also be shared with the Freeholder Board. And if you don't know how to get in touch with them, simply email them at mail@sussexcountychamber.org. Before I conclude my report today, I wanted to express my deepest appreciation for the service of Sussex County Under Sheriff John Thomasula, who we lost last week. I wanted to express my condolences to his family as well. Last weekend, I had the honor of attending a drive-by salute for Under Sheriff Thomasula, and I have to share with all on this call that it put Route 80 in rush hour to shame, and it was beautiful. It was a timely reminder of just how many good people there are in our communities and that hope can be found anywhere at any time. And on that day, hope was delivered one quarantined, socially distanced car at a time, and it was really, really special. I also wanted to thank our healthcare workers, emergency responders, and all those who continue to keep this county up and running safely as we applaud you. I've only known Sussex County to be strong and resilient, and that has only been amplified through this unprecedented and demanding crisis. We'll get through this, and we'll get through this together. Thank you, Freeholder Director Patillo, and that concludes my report for this evening.
Thank you very much. Next would be Freeholder Herb Yardley.
Thank you. Just a couple comments. My heart goes out to all of those that have passed away, the nursing home, and all of those that have passed away on a COVID virus in our county. Just a couple comments that I've observed. I wanted to comment on Eric Obenauer's article that appeared in the New Jersey Herald newspaper. I want to say that that article opened the doors for more transparency in the state of New Jersey than many of the pieces of legislation that have gone through the governor's house. I've been monitoring many of the sites throughout the county, and we didn't see nursing homes listed. Now you're starting to see the deaths and those people that come that have been diagnosed are being listed, and the numbers are showing, at least at this point, as nursing home. Not necessarily identifying yet. But I think there was a benefit to the article. I think the state of New Jersey should be ashamed of themselves for not doing this years ago. The system that has been used by many of the health departments could not deviate from what the state had planned. And so now we're seeing that, and I hope that that will be benefit to everyone that has a family member in a nursing home. In addition to the state reacting to that article, a lot of this happened within 2 days. There's also the federal government, the Center for Medicare and Medicaid Services. They're now going to be investigating many of these situations. They're going to require 12 hours when you confirm a case. Families, residents, relatives must be told when 3 or more individuals develop respiratory symptoms within a 72-hour. These are all new rules as a result of what has recently happened. Nursing homes have been ground zero for COVID-19, and I really hope that we are able to, the state of New Jersey is able to get a handle on this and that there's a benefit for everyone involved. I also would like to comment on the National Association of Counties just announced that on round 2 there will be additional funding for us and other counties that are in our situation with a population of 50,000 people or more. It will give us an opportunity to apply. We do need to send some letters to all of our our federal representatives and ask them to support the new bill. Aside from that, I am, like many people, at home, hoping that we get through this and that we all are safe and that we all have an opportunity to get outside and do some exercise. Thank you.
Thank you. Can I please ask Freeholder Josh Hertzberg, please?
Yes, thank you, Sylvia. I want to speak on Andover subacute a little bit also. Anthony did a great job explaining, the history of what went on, but I want to make sure that the record is clear that we called asking for this facility to be addressed well before things got out of control. We asked for the state's help before the bodies started piling up, and those bodies were people that we all knew and some of us knew and loved, and the system was not working and did not work. It didn't work for them. It didn't work for the people that work there, and it didn't work for the patients that are there. But that's already happened. We can't fix the past, but we do need to concentrate on some things moving forward, protecting the patients and the workers who are still in there right now. We haven't forgotten about you, and we won't stop until we make things right. We continue to get calls and messages from workers, from patients, from loved ones who are scared to death of what's going on over there. We have to work with our assemblyman and our senator to make sure that we have legal ways to protect the people of Andover subacute. We need more local oversight. The state from Trenton is just not able to do what they're supposed to do as far as oversight there. And I can say that I know all our local District 24 representatives are committed to fixing this. I know this 100% because at 10 p.m. on Saturday night, Steve Oroho was on the phone calling people for help because I had received a message from somebody in the facility, a patient, who was scared because they didn't think that there was enough staffing to help them. This person, was calling out for help. And I got to thank my colleagues on Freeholders, our administrator, Greg Poff, and especially Chief Danielson and Senator Oroho for, answering my call at 10 o'clock on a Saturday night and jumping into action to try and help. A special message to that patient who I won't name, but you can call me anytime. I also want to talk a little bit about SCUMA, as you heard in the beginning from our director, that they are pulling tonight's what was to be voted on. I want to thank SCUMA for having the wherewithal to ask that their current plan be tabled while they assess the situation. Nobody really knows what the future will hold, and I thank them for their diligence. It doesn't change the fact that we will need to expand capacity at the facility, but I'm glad they are taking a second look at it while we work through this current crisis. I also want to talk a little bit, Anthony touched on some of the economic impacts that we're dealing with right now, and that the Chamber and the Economic Development Partnership are great resources in our county. We had an Economic Development Partnership board meeting this week, online, of course. There was a lot of discussion about the state of federal aid, the problems with that rollout, the lack of funding in our area, and the complexity of actually trying to access that funding. Many of the local banks were not initially set up to be lenders through the SBA. Most of that has been resolved, but it's all about getting an adequate amount of funding now. I want to thank all the people chipping in all over our communities. It's really been amazing, from the restaurants donating food to the hospitals to the people donating money, supplies, their time and effort. It's really been, kind of guess what we get used to in this county is everybody chipping in when they need to be. I want to give a special thanks to Mountain Creek, who is utilizing their 8-person finance department to help local businesses who need help trying to figure out all this loan stuff. So I want to thank them because they are, donating their time and their effort to help others and other businesses in the community, and I think that's great. The EDP has been conducting, as Anthony also said earlier, conducting surveys that are compiling a lot of data that we hopefully will help businesses once we try and get back on track and this craziness is over. I hope to be able to shift some of my focus on preparing for getting our economy back up and running. Our community is going to need that. We clearly need to prioritize the public's health first, and I think that's what we're doing. But we certainly need to start preparing to make sure we can revive our economy. It's currently on life support, and it's going to need a little help getting kick-started, especially in our state and even more so here in Sussex County. We have to make sure that we are not forgotten about again. Thank you all for attending tonight, and that's all I have, Director.
Thank you very much. Deputy Director Dawn Fantasia, please.
Thank you, Sylvia. I have a report in quite a few areas. The first I would like to talk about, the county's providing a revised format for the press release for COVID-19 positive cases. So as of now, the daily statistics are taken from the New Jersey State Communicable Disease Reporting Surveillance System, CDRSS. Statistics will be gathered at the exact same time each day because the system, it's a living document that changes as each case hits. However, because of that, the data may differ from day to day and is subject to revision. It's the same database that's used by the state of New Jersey when they post their COVID-19 cases on their NJDOH dashboard. So the county press release is in a chart format. It lists the number of positive COVID-19 cases by municipality, as well as the total COVID-19 cases within the county. So that information is a snapshot in time and reflects all COVID-19 cases posted within CDRSS. So I've also been assured that the epidemiologist that's working with the county will be preparing more visuals, including graphs and charts, to be shared with the public. Now, Public Health Nursing has created a team to investigate the number of Sussex County residents who've recovered from COVID-19. And as of today, the team members are contacting each resident who's tested positive for COVID-19, and they're being surveyed, asked information designed to determine if they are recovered from COVID-19 and where they are in the continuum. So this is going to be an ongoing process. So the public health nurses and the Medical Reserve Corps volunteers are available to provide New Jersey Department of Health guidance to those residents who may have additional questions. As we touched on, working with Morris County, we have our COVID-19 testing site that is available to Sussex County residents. We are continuing to work for our own stand-up testing site within the county. I spoke with Sheriff Strada. We speak daily. I spoke with him this morning, and he told me from an OEM standpoint, his pieces are in order right now. The county's in discussion now with medical providers because this is multi-pronged. So you need the PPE, you need the testing site, you need the OEM involvement, you need the staff, you need a medical entity to actually pair with you. So some of the other counties, you may see that they're paired with different agencies and local hospitals. So currently right now I was told that we are in talks with Atlantic Health. So I hope to have an update, and we hope to have that moving quickly. Once that plan is cemented here from the county perspective, we submit the final plan to the New Jersey Department of Health for their approval. I do want to also state that the largest number of Sussex County residents that have reported to the Morris County site for testing, and if you recall, there were 240 tests put aside for each testing day for Morris County residents, and 75 put aside for Sussex County residents based upon our populations and ratio. The largest number of Sussex County residents that did go to that site for testing in any given day was 38. So just to have that in perspective, and again, I know it is a bit of a commute to go to CCM. Our goal is to really get our testing site up and running here in the county, and now I feel that we're availability for these shared resources across the state are now easing, and I can even see in the numbers of PPE that we're receiving that we're able to distribute. I would like to share with you some data shared with me today by Sheriff Strada. It involves PPE that has been distributed, and I want to first talk about Andover subacute. Beginning on April 1st was our first delivery of items to Andover subacute by way of PPE, and there's been multiple deliveries since, but as of today, I have the final total. So for total N95 masks, and this is in combination delivered to Andover 1 and Andover 2, the county has distributed 4,420 N95 masks have been distributed to those two facilities. Surgical masks, just the standard surgical masks, not the N95s, we have delivered 15,750 surgical masks to the facility. Face shields, 435. Gloves, I got a breakdown in by size, but roughly 10,000 gloves were delivered. By way of goggles, 68 pairs of goggles have been delivered to that facility. Gowns, 20 gowns. Gowns seem to be more difficult to get a hold of. And by way of hand sanitizer, we have distributed 4 of the large jumbo size and 200 of the standard size bottles. And shoe covers as well have been delivered. 100 pairs of shoe covers have been delivered to that facility. Now, being that is not our only facility that we're serving, I also requested, and Sheriff Strada provided to me immediately, the list of facilities that we have been providing PPE to, and it's quite extensive. Not only our assisted living and nursing home style facilities, but also different OEMs for the towns. So overall, we've distributed over 10,000 N95 masks by way of surgical masks, 53,850, 750 face shields. By way of gloves, easily over 25,000 pairs of gloves have gone out to all of our different agencies and healthcare providers. So I just wanted to give you the general update because I know that has been a question that we all have been asking regarding PPE, specifically when we see reports from places like Andover subacute, where we hear the employees are working with a single mask or there are no gloves. I've been on the receiving end of multiple panicked phone calls, messages from former classmates of mine, from constituents who I don't know. A local funeral home director in Sussex County also contacted me to tell me a report that he filed with the state of New Jersey on March 27th for what he had found. I don't know how to say this any other way than I'm appalled at the lack of urgency and the response from the state of New Jersey. Our county health department has been relentless in reporting all of this information and intervening up to the level we could, and then even beyond the level that we could, because we're talking about people here. These are people's lives, these are people's families, and these are people dying, and it's not acceptable to any of us. Now, in reading up on this in the past week by way of local control, I do notice Camden County has taken a much more aggressive local control approach in the city of Camden, and their local health department is grabbing the reins because they also saw the writing on the wall that people are dying and they need immediate assistance. So I want to thank everybody in the county. It takes an army to go in when you know people are suffering and you know employees in that facility are suffering, and they're not being heard and they're not being helped. So if that means that our county has to step up and go above and beyond what would even be permissible, I am perfectly fine with going on the record of saying that because people are dying, and I've had about enough of the state of New Jersey with this. It's absolutely unacceptable. Now I want to talk about our Medical Reserve Corps volunteers. I want to thank our wonderful Medical Reserve Corps volunteers who have been an integral part of Sussex County's COVID-19 response. Their dedication to keeping the community safe is very appreciated. And if you're interested in becoming a Sussex County Medical Reserve Corps volunteer, you can visit our website, sussex.nj.us, and you can register. And again, when we talk about a testing site, what's really helpful is a lot of times in these local testing sites, we have staff members and healthcare professionals, let's say from Atlantic Health or whatever company or facility you're pairing with, but volunteers really drive the ability to have enough staff to be able to process a large number of tests. So we're really interested in amassing volunteers for this cause. Now, the Sussex County Hunger Coalition also and the Sussex County Human Services Advisory Council have created a food distribution service for those in Sussex County who need food pantry home delivery. So Norwest SCAT Pathways to Prosperity is offering food delivery services every Tuesday for those who aren't able to drive or who lack transportation. So if you'd like to sign up for their delivery service, you can call 973-862-6680. And you can get yourself signed up for that. And again, if you check our website, sussex.nj.us, the list is fluid, but there's a list of the most up-to-date food pantry services that are being offered. Now, I want to touch just a little bit on some of the business and the Chamber of Commerce. So weekly, I want to thank Tammy Horsfield, who has just done an outstanding job in doing whatever she possibly can to keep the business community informed and trying to get as many resources out there as quickly as possible. The COVID-19 State of Affairs briefing with the Sussex County Chamber of Commerce is able to give information to that group, much like we're providing to you in our commentary tonight. The last call I was asked to participate in, and there were over 150 people on that call. And it was a nice sense of community and a way that all of the businesses could speak together, share some of their concerns, and hear from our federal representatives, state representatives, and county as well. There'll be another call this Friday. Last week, Sylvia Patillo, our Freeholder director, participated. I participated this Friday, and this week, Herb Yardley will be the Freeholder representative on that call. Also, I've been fielding some calls and messages about individuals who are struggling with unemployment and getting through the website or receiving their benefits. We've been informed that the state has provided 500 extra laptop computers to workers to work from home to help process the overwhelming number of claims. If you are jammed up and you are not able to get any result, you can always reach out to either us or the District 24 office. I have to say I'm very thankful. Senator Oroho has helped a couple residents here in Franklin who had reached out to me to be able to get them some answers and a better sense of a timeline for what's headed their way regarding their unemployment benefits. There also was a grant program that had come out just today. It's the NJEDA Entrepreneur Guarantee Program. It's a $5 million program that encourages investment by encouraging private sector investors to provide additional working capital loans to New Jersey-based businesses, so where the investor is the actual holder. So there's applications that had opened today. The NJEDA will guarantee up to 80% of the total investment amount not to exceed $200,000 per New Jersey entrepreneurial company. So there's requirements for investors if you choose to be an investor, and there's also requirements for the actual business. A couple small details about it. Fewer than 25 employees. A minimum of 50% of your employees have to be in New Jersey, and your business must fall in one of these 8 sectors in Governor Murphy's economic plan. So it's advanced manufacturing, information technology, life sciences, finance and insurance, clean energy, food and beverage, advanced transportation, film, and digital media. So I encourage you to visit the EDA, New Jersey EDA website. Right on their page now, there's a landing for COVID and businesses that are affected by COVID, and you can just read, and the site is very, very easy to navigate. Unfortunately, the U.S. Chamber of Commerce released a program this week that was beyond short-lived. It was the Chamber of Commerce Save Small Business Fund. It was a grant-making initiative to offer short-term relief for small employers in the U.S., so it could provide $5,000 grants to as many small employers as possible. So it was for small businesses between 3 and 20 people. You had to be located in an economically vulnerable community and been impacted negatively by COVID-19. So this application opened up on April 20th at 3 p.m. Eastern Time. And you could go in, you plug in your zip code, and I put in all the Sussex County zip codes, and something odd came up that Ogdensburg was excluded from this, as was Sparta Township and a few other towns. But demographically speaking, it didn't make sense to me that Ogdensburg would be excluded. Towns, Vernon was included. So when I was looking at the demographics, it did not make sense. So it turns out that this website was actually misplacing on the map the town of Ogdensburg as being part of Norfolk, which is why anybody from Ogdensburg that tried to apply was not eligible at the time, and that was definitely an error. And unfortunately, not 6 to 7 hours after the program launched at Eastern Time,
Dawn, are you there? Dawn? We lost her. How do we get it back? Right now, I don't have any voice coming from Dawn Fantasia, so we'll have to wait until she calls back. Josh, are you there? Maybe we're off. Josh, are you there?
I apologize.
No,
For some reason, the call dropped.
Okay, great. Thank you,
I'm
Dawn.
sorry.
Please finish.
Yeah, I don't know what happened there. So anyhow, to make a long story short, I don't know how many Sussex County residents did apply, but I really want to again thank Tammy Horsfield for getting that information out quickly. So we had many businesses that were at least aware that it was happening and went on in the attempt to be able, to take advantage of that program. Just a couple other things here. It's very, very important that we all complete our census forms. I know in the more urban cities, there's a big push for counting every single resident, and so much funding is determined based upon census results. So I know the census is not exactly something that's in the forefront of all of our minds right now, but it certainly should be, because we see the fallout and the after effects of not accurately answering the census. So again, we won't have the individuals, this spring going around knocking on doors. You can't social distance and do that. However, I think we really, as a county, need to be pushing out more information in the importance of individuals replying to the census, so every single individual in this county is counted, and so we are funded properly. We've seen clearly that this county is behind the 8 ball. All the rural counties in the state of New Jersey, with Sussex, Warren, Hunterdon, Salem, in that first round of funding got nailed. This cannot keep happening. So we need to make sure every single individual is accounted for. And last, I know we give our thanks to different individuals around the community and within our county, but today I'd really like to thank the road department. They're considered essential, and our county road department, things don't stop because of COVID-19, as I discussed in our last meeting when we talked about the need for mental health support. The need to keep our roads functioning and keep them repaired. None of that stops. Trees don't stop falling because of COVID-19. And I have to say our road department is working hard, and they are just a wonderful bunch of human beings who are super selfless in a really, really bad situation. So I specifically wanted to thank our road department tonight. And that concludes my report. Thank you.
Thank you very much, Dawn. I want to thank everyone for their patience. I know that our comment period takes a while to get through, but this is our time to give you information. So I have a few of my own issues that I'd like to speak about. When the governor called the state of emergency because of the coronavirus, everything changed. Information came flowing in and updates followed, sometimes every hour and sometimes every few minutes. Every day there were new challenges, and we reacted according to what was happening around us. Days felt like months, and months felt like years. When you are dealing with life and death, every moment is precious because every life is valuable. This health emergency changed our lives and helped us reevaluate our priorities. Now we appreciate our families, our friends, and our neighbors. and we are engaged in prayer and exercising our faith together and offering help to those that are having a difficult time. We are a kind and compassionate community, and we will make it through together. Tonight, I would like to offer my condolences to the families whose hearts have been shattered by the loss of loved ones. I would like to offer my prayers for those who are ill, and I would like to offer my hope for anyone that is feeling fearful or anxious. The county is working hard on your behalf, and we are here to help you. If you have questions or need food or counseling or other resources, please don't hesitate to call our hotline at 973-579-9488 from 9 to 4 on Monday through Friday. If you are in need of treatment for substance abuse disorders, the Center for Prevention has increased their staff to operate their Clear toll phone line, and that number is 844-722-5327, and they are on that line 24/7. They continue to care for their clients utilizing outpatient services, and counselors are using telehealth services for all needed levels of outpatient care. Narcan kits are also still available at no cost. Now I'd like to give you a little update on what our role of our public health nurses are in relation to the COVID-19. Our public health nursing, they conduct investigations of each positive case. They call the positive individual to confirm their demographics, their physical address and age. They investigate their symptoms, including the date of the onset, verify close contacts, and provide them with New Jersey Department of Health medical guidance regarding COVID-19. They ensure that they have contacted their health care provider and give them information on what to expect with worsening symptoms, encouraging them to seek medical care immediately if their symptoms worsen. They also ask if the person requires any type of support care, such as access to food, and if they have a family member or neighbor to assist them if needed. The nurses follow up with all close contacts to provide guidance for self-quarantine, answer their questions, and provide New Jersey Department of Health guidance on symptoms and when to contact their medical provider. They also work with medical care providers, providing New Jersey Department of Health guidance. Public health nurses do not advise the long-term care facilities. What they do is they provide guidance from the State Department of Health to the long-term care facilities. All the data is entered into the Communicable Disease Reporting Surveillance System. Nurses speak with family members and residents to answer their questions. This is in addition to the daily ongoing important PHN work, such as rabies and lead investigations. Currently, the county has hired an epidemiologist who began working last week. She oversees the COVID-19 investigative activities, provides consultation and advice to healthcare providers, infection control professionals, and others. She is responsible for the organization of all data into the New Jersey Communicable Disease Reporting Surveillance System, as responsible for surveillance and reporting of communicable diseases such as COVID-19. Our public nurses are caring and compassionate people, and I'd like to just take a moment to tell you the story about one of them. All the nurses develop a relationship with families, and recently we spoke with a very concerned son whose father was placed on a respirator. The nurse answered the son's questions, which helped the son understand the usual process when a person is placed on a respirator. The son contacted the nurse again because his dad was being removed from the respirator because he was not improving. Once again, the nurse provided answers and compassion. Later that week, the son called to report his dad was recovering and being removed to a rehabilitation center. The son expressed his gratitude to the nurse as a lifeline for him during this difficult time. I am very grateful for our nursing staff. They are very compassionate people. The next report I have is from the hospital, from our new president, Bob Adams. And he said, "Hi, Freeholder Patillo. Thank you for all your support. I hope these summary bullets are helpful to you. Overall, COVID-19 cases in Atlantic Health hospitals have leveled off, and we are seeing decreases in COVID admissions. At Newton Medical Center, 50% of the hospital census is COVID-19 patients, and the surge in critical care we have experienced for the past 6 weeks is beginning to level off. We have 52 COVID patients in the hospital today. That is down from our peak on April 15th of 68. We have transitioned over 75 COVID patients to home. We are extremely grateful for the outpouring of support and donations to the hospitals. Your appreciation for us and your support inspires us every day. We will be transitioning back to performing more urgent outpatient imaging and surgical procedures as the COVID admissions in our hospitals continues to decrease. We continue to coordinate with the post-acute long-term facilities in our region who are managing large outbreaks of the virus in their facilities." I want to thank Bob Adams and his staff at the hospital for the amazing work that they're doing. But I would like to take a moment to address what happened over at the Andover facility. We were receiving reports from people inside, from families, and it took time to get the attention of the state. Our Division of Health was sending emails, follow-up calls, put complaints on their complaint site, and trying to get the attention of the ombudsman, whose job is actually to protect seniors in long-term care facilities. Although it took time for them to respond, they are there now. They have sent in their surveying team and their CMS team, which are reps from Medicare and Medicaid services. And as we know, this facility is regulated by the state of New Jersey, and it was the state of New Jersey that dealt with the owner of the facility. From the reports that they had, that we heard on the conference calls, at first they thought that the staffing was appropriate. However, on April 20th, things changed. And the state servers have been out to Andover and 20 other LTC facilities to inspect and assess their compliance with state and federal regulations and guidelines. And these include infection control, staffing, availability of PPE, and implementation of an outbreak response plan. The facility had to have a directed plans of correction to the state of New Jersey on this Monday, April 20th. The Andover Subacute Rehabilitation Facility is required now by the state of New Jersey to hire a consulting administrator, a consulting nurse, and an infection control professional. They must also cease having new admissions, as well as provide a progress report by the end of the day, Monday, which was the 20th, on the selection of the aforementioned positions to be approved by the New Jersey Department of Health. I spoke to someone at OEM today, and they told me that the state is sending the state police PPE equipment that is marked specifically and set aside for the Andover facility. So that is the beginning of the changes that the state has asked for from the owner of that facility. And it's important that you understand that the county does not have any authority or jurisdiction over the Andover facility. That is regulated, controlled, and overseen by the state of New Jersey. But we all felt helpless, and we continue to strive and work with everybody within our agencies to help support what we can support at that facility. And my heart is broken for what's going on there. And our concern and our love and compassion is with all of the families. All right, so having said that, our freeholder comments are finished, and we're going to move on with our agenda. And when we get into the last public comments, everyone that would like to speak about anything else other than the agenda is welcome to speak. So please bear with us. At this time, there are no consent agenda issues, so we can move to number 12, which is the approval of the minutes. Can I have a motion to approve the minutes from the regular meeting, April 8th, 2020?
So moved,
So
Fantasia.
moved.
Okay, and a second is Josh Hertzberg?
Yes.
Okay, is there any discussion or changes? No? All in favor, please signify by saying aye.
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 Any opposed? No. Okay. There are no appointments and or resignations tonight. And we're down to number 14, which is our resolutions. 14A was pulled at the request of SCUMA as we amended the agenda. So we'll go to B and C. Can I have a motion to adopt said resolutions B and C, please?
So moved, Fantasia.
Second?
Second, Hertzberg.
Yardley.
Okay. Is there any discussion? Okay, Terry, a roll call, please.
Freeholder Fantasia,
Yes.
Freeholder Fasano,
Yes.
Freeholder Hertzberg,
Yes.
Freeholder Director Patillo,
Yes.
Freeholder Yardley.
Yes.
Okay. Thank you. We're on 15, awards of contract, change orders, and bids. The Board of Chosen Freeholders of the County of Sussex has reviewed the award of contract, change orders, and bids consisting of various proposed resolutions and determined that adoption of the said resolutions is in and will further the public interest. Resolution A is the award of contract for miscellaneous building trade services, masonry, to be performed in and around various Sussex County buildings to Tony's Concrete Construction Company, Inc., from May 1st, 2020 until April 30th, 2021, in amount not to exceed $500,000. May I please have a motion to approve the contract?
So moved, Fantasia.
Second?
Second, Hertzberg.
Is there any discussion? Not hearing any, a roll call, please. Terry?
Freeholder Fantasia,
Yes.
Freeholder Fasano,
Yes.
Freeholder Hertzberg,
Yes.
Freeholder Director Patillo,
Yes.
Freeholder Yardley.
Yes.
Okay, we are on number 16, financial. The payment of bill list of April 22nd, 2020. Can I please have a motion to approve the resolution?
So moved, Fantasia.
Second?
Second, Hertzberg.
Anthony.
Okay, Josh Hertzberg. Is there any discussion on the bill list? Okay, not hearing any. Can I please have a roll call vote, Terry?
Freeholder Fantasia,
Yes.
Freeholder Fasano,
Yes.
Freeholder Hertzberg,
Yes.
Freeholder Director Patillo,
Yes.
Freeholder Yardley.
Yes.
Okay, number 17, personnel. We have a resolution authorizing personnel agenda of April 22nd, 2020. May I have a motion to adopt the personnel agenda?
So moved,
Herb
Fantasia.
Yardley, yes, second.
Okay, thank you. Are there any discussions? Not hearing any. Can I have a roll call vote, please, Terry?
Freeholder Fantasia,
Yes.
Freeholder Fasano,
Yes.
Freeholder Hertzberg,
Yes.
Freeholder Director Patillo,
Yes.
Freeholder Yardley.
Yes.
Thank you. We're on 18, the administrative report, so I'll turn it over to our administrator, Greg Poff.
Thank you, Director. I'll keep my report brief as I appreciate the freeholders giving a very comprehensive report of the various activities that the county organization has been involved with over these last few weeks. My comments simply are, I continue to work with the county's emergency preparedness team and Office of Emergency Management, having recently secured the agreement between Sussex County and Morris County to open up testing at the Morris County site. As has been reported on previously, I've been working with the Office of Emergency Management and our emergency preparedness team in developing a plan that would allow Sussex County to stand up its own testing facility, and we will have more information about that in the coming days as we finalize that plan and secure the remaining resources needed to stand up that site. A couple of items that we've received through social media, and I'd just like to touch upon so that everyone is aware. Again, some of these items will have already been taken care of by the Freeholders' comments, but that through the Office of Emergency Management, the county continues to work with our contracted vendors and adding additional vendors to secure necessary personal protective equipment and equipment that is necessary for our agencies and first responders. The State Office of Emergency Management currently monitors and supports the personal protective equipment needs for local hospitals and long-term care facilities based upon the number of confirmed COVID cases. The county also continues to accept personal protective equipment donations, and anyone that is interested in donating may contact the county at 973-579-0380, extension 2220. Again, that number for personal protective equipment donations is 973-579-0380, extension 2220. As previously mentioned, we have a number of partners who have been collaborating to provide for a safe and efficient delivery system of food for those in need of Sussex County. A list of the most up-to-date food pantry services is available on the county's website at www.sussex.nj.us. Norwest Cap Pathways to Prosperity and the Sparta Ecumenical Food Pantry are offering food delivery services for those that are not able to leave their homes or are lacking transportation. Again, that is Norwest Cap Pathways to Prosperity and the Sparta Ecumenical Food Pantry. We have been working also with our social services group, ensuring that the governor's executive orders are being enforced, particularly as it pertains to water, gas, and electric utilities, making sure that they have suspended shutoffs to those that may have difficulty in currently making their payments for those utilities. Those that are facing eviction or utility shutoffs after the public health emergency has ended can reach out to the Sussex County Division of Social Services at 973-383-3600 for assistance. Again, that is the Sussex County Division of Social Services, available at 973-383-3600. I was very pleased to hear the Freeholder Director's comments shared by Atlantic Health Systems, as Atlantic had also made a very similar presentation to our weekly call that we have with all of the county's municipal mayors, and was very pleased to hear that based upon the information observed by Atlantic Health Systems and specifically Newton Medical Center, that the apex of infections in Sussex County has turned into a plateau. We continue to hold weekly calls with all of the Sussex County mayors and administrators and clerks to keep them informed of these developments. We had our most recent call yesterday, and we'll have our next call next week. And with that, that concludes my report. Thank you.
Thank you very much. County Council, Mr. Kelly,
Yes.
do you have anything?
Sylvia, I would just like to delete the litigation matter listed on the executive session. There's been no updates from the attorneys involved.
Okay, thank you. We don't need a vote
Thank
on that, do we, Greg? No.
No.
Okay, thank you very much.
Thank you.
Number 20, is there any unfinished business with the Freeholder Board? No. Is there any new business that you would like to bring up? No. Okay. All right, now we're at 22, which is the public session from the floor. And this public session, you can speak about anything you would like to speak about. And thank you for waiting and having the patience that you've had this evening. Again, before we open the hearing, we ask that callers wanting to make a comment to first state their name and municipality, and the clerk will create a roster and she will call each in the order received. And everyone is asked to keep your comments to 3 minutes. So can I have a motion from the board to open the floor for public comment, please?
So moved, Fantasia.
Second, Anthony.
All in favor, please signify by saying aye.
Aye.
Okay, the
Aye.
floor is open to the public at this time. Would you please give us your names and municipalities, one at a time, please?
John Mannion, Montague.
I'm sorry, what, caller? John from Montague. What is your last name?
Mannion.
Can you spell that?
Mannion.
Thank you.
Okay, thank you.
Christy Lavin, Hardiston.
Raven, okay.
Jackie Espinoza, Newton.
Michael Newton.
Michael, what is your last name?
Well, I'd really like to keep that anonymous just because of what I have to say. I really don't want to, I'm afraid of repercussions on my mother.
That's fair.
Thank you for understanding.
Irene Buckley, Green Township.
Lauren Collier, Sparta.
Zoe Heath, Vernon Township.
What was your first name, please?
Zoe, Z-O-E.
Okay, I have it, Zoe, okay.
Doreen Edwards, Vernon Township.
Next, is there anyone else?
Yes, Sonia Grunwald, Sparta.
Sonia?
Sonia, S-O-N-I-A.
IA, okay, thank you, and that's Sparta. Do we have any more speakers?
Can you hear me?
I can.
Oh, okay. I wasn't sure if I had to press a number before my voice was heard. Thank you. So I did give my name just a minute ago. Thank you.
Okay, so I have John, I have Chrissy Lavin, I have Jackie, Michael, Irene, Lauren, Zoe, Doreen, and Sonia. Did I miss anyone?
Yes, Michelle Van Allen, Hardiston Township.
Okay, thank you. Okay, Terry, is there anyone else? All right, Terry, would you please begin?
Yes, I'm calling the first caller, John Mannion. Please understand, callers, that I am monitoring your time. I will give you a 1-minute warning before your time is up. Mr. Mannion, please proceed. Your time is starting.
I don't hear it. Let me know.
Okay, I need to rebut. Comment is about 3 minutes, but I need to rebut first, especially to Dawn Fantasia.
20.
get a speeding ticket in Opakon, if I get a speeding ticket in Sparta, it's a state charge, but it's the local authorities that pursue the charges. When Dawn blames the state for the county's shortcomings, she is simply passing the buck and wiping her hands clean of it. This is a county issue, and this is a county problem, and the county has not handled this the right way. This is a county thing, not the state of New Jersey. Do not blame the state of New Jersey, who has been very proactive. Now I will move on to my comment. For over 3 weeks, while the death toll of long-term care patients in Sussex County due to the coronavirus was steadily climbing into the triple dozens, our county health department and county administration refused even to acknowledge that there was a problem with these nursing homes. Instead, like typical bureaucrats, they continued keeping a running tally of the daily death toll and funneling the body count up to the state, while the rest of us county residents, including some who have relatives at these facilities, were kept in the dark. And yet, admitting that mistakes were made, which some of us could forgive. All right, one of you guys, you're cutting into my time with the feedback here. Our county administrator accused a New Jersey Herald reporter of threatening him and hung up the phone when he was asked for the information, and our county health officer lied to the New Jersey Herald by claiming he couldn't release the information even in the most general terms because of patient privacy rules. If that's true, then how is it that last Thursday, after the full scale of the death count started to become known, our county administrator, Mr. Poff, was able to put out a statement about Andover subacute, saying how concerned he was, and that I quote, "The total number of deaths as of April 15th at this facility was 57 total deaths, of which 26 were COVID-19 related." What law suddenly changed that prevented our county administrator and county health officer from releasing this information previously? And if our county administrator and our county health department weren't responsible for the decision not to release the information, then who was responsible? And who advised them not to release it? The arrogance of these officials and their continuing refusal to answer these questions leads to one inescapable conclusion, that this wasn't an honest mistake, but a purposeful cover-up. Nobody is faulting the county freeholders for this. We understand that it's not your job to supervise the day-to-day job performance of the people.
1 minute, Mr. Mannion, 1 minute.
High levels of responsibility, but it is your job to hold them accountable. It is bad enough when there is a lack of transparency in general, but here we are talking about matters of life and death, and we, the public, deserve an apology, and we want answers. I also want to say a word about the $180,000 a year administrator, Gregory Poff, telling off a reporter who was asking for information and then hanging up the phone on him. If this is how Mr. Poff treats the press, how do you suppose he treats the general public? I don't care if Mr. Poff was feeling tired or stressed that day after a hard day's work, or whatever excuse. I can find you doctors and nurses who have real stress from working double shifts, treating sick patients, and don't act this way. I can find you people who are out of work and are dealing with real stress. Mr. Poff still has a job, and as long as he does, he needs to understand that he works for you and he works for us.
Mr. Mannion, your time is up. Mr. Mannion, your time is up.
One more sentence.
Mr. Mannion, your time is up.
That is the county's problem.
Mr. Mannion, your time is up. Thank you. Christy Levin from Hardiston, it is your turn.
Thank you. So I don't have a prepared statement, and I'm gonna speak candidly. First, I'd like to say thank you for some of the statements that were very compassionate regarding Andover subacute. In particular, Freeholder Fasano. I just thought a lot of the things that you said were very compassionate. I called in for a lot of reasons. I obviously, as a community member, care very much about what's taking place, but also I was personally affected in that my uncle was one of the individuals that passed away at Andover on April 4th. So obviously, I have personal investment in what took place since that time. I've been doing everything in my power to see what can be done. I've been calling legislators. much like many of you have been doing. And I think now is not the time to be blaming anyone, the state or otherwise. I think now is the time to see what can be done in the future in terms of prevention. And on a county level, what is within your power to make sure nothing like this ever happens again. And when I think about what you can do, you could be transparent. You can educate the public in terms of long-term facilities. That's where our most vulnerable reside, the elderly. And in terms of Andover, many have a mental health diagnosis. So how can we educate the public and make sure that family members know how to reach out to the ombudsman, how to reach out to the state to voice grievances? That's something that is within the county's power. So I just urge you on a county level what you can do to prevent something like this ever happening again. And instead of looking to blame anyone else, I think it's important that you take a leadership role here for the family members' sake, because they're not looking for you to look who to blame. They're looking for you to take a leadership role. Thank you.
Thank you. First caller is Miss Espinosa from Newton.
Hi, this is Jackie Espinosa from Jersey Central Power and Light. My office is in Newton. That's why I responded for Newton. But this is on a lighter note. First of all, thank you to all the freeholders and Greg Pop for what you're doing and holding this call and letting us speak. And this is definitely on a lighter note. I just want to give a shout out to the JCP&L line workers. It was Line Worker Appreciation Day over the weekend, and they are essential workers and they're reporting to work every day. And First Energy is implementing a lot of precautions to be sure that they keep the environment safe. If something's going on at your home, you may see several trucks show up because each employee will have a separate truck so that they are not in the same a truck, and they're providing social distancing. But last week we had a storm, and it did affect about 9,000 customers in Sussex County, and they were able to restore all the power, I think within 24 hours, maybe a few went over that, and they did it safely, and we had contractors helping us out as well. So I just want to give a shout out to them, and also our First Energy Foundation. We are a First Energy company. Also gave a significant donation to the food bank at Project Self-Sufficiency. So I'm sure some of the residents are, taking advantage of that. And they also posted something in the Herald as well. But thank you for all you do. I know this is a very trying time, and I really appreciate it. That's all I had to say. Thanks.
Thank you very much.
Thank you. Our next caller is Michael from Newton. Michael, are you there?
Yeah, good evening, everyone.
All right, you're
Let me
starting,
just say
Michael.
that I'm calling from Florida. I was a resident up there until October, and my sister is there as an advocate for a mother who is a resident in Building 1. I've been on the phone with everybody from the Freeholders office trying to Sussex County Health, New Jersey Department of Health, the District 24 Legislative Office, the Office of the Ombudsman. I've actually had a lady from the state of New Jersey tell me that anything, besides being told with my mother is none of my business, okay? We never got official notice until April 6th that 5 people who tested positive were in quarantine and 4 other people were awaiting results, okay? We never got any notification about anything, and we didn't know anything until the paper blew up with all this, okay? As far as I'm concerned, I don't care what was said tonight by who in that office. There's plenty of blame to go around, but the time for blaming and finger pointing is over. And I'm pleading with you people to step up to the plate. My mother was diagnosed with a low-grade fever over there. Now, they say they're short-staffed. Right away, they assumed it was the COVID. There was no test. They started on the medicine. They isolated her in a room with another woman that has a low-grade fever. Well, guess what? Nobody's checking on my mother. From what I understand, the doctor doesn't even come in there. He Skypes with the nurses. But I'm sure he's got no problem charging Medicaid for a bill. okay? My mother, in turn, it finds out she had an infection and had other issues which caused the fever. If it wasn't for her being moved to the lower floor and my sister being able to go over there and see her through the window and insisting that something was wrong and that she'd be taken to the hospital, as far as we're concerned, she would have been left there to die. And I'll be honest to God with you, she probably would have died in 2 or 3 days because her kidneys were starting to shut down. She was so severely dehydrated. I understand the COVID breakout is serious, and this is the main problem. But there's other people in that facility. Thank you. There's other people in that facility with other issues, and people need to be getting in there and checking them. Doctors. He took a Hippocratic oath, okay? You have dietary workers, housekeeping in there working. Why can't he gown up and check on his patients? I am pleading with all of you right now. Put yourself in my family's position. Please take action. Quit finger pointing, blaming. Let's all get this done together. Do something about it because innocent people are dying over there, and some of them don't have anybody to advocate for them. Thank you.
Thank you very much, Michael.
Our next caller is Irene Buckle from Green. Is it Buckle or Buckley?
Buckley.
Buckley. Thank you, from Green Township. Irene, your time starts now.
Thank you. I have 4 questions and 1 comment. My first question is directed to Kevin Kelly. I called Susie at the clerk's office, and she advised me with a question, and she advised me that you would call me. This was back on April 16th, Thursday. I have not heard from you, and I was wondering when you would be giving me a call. Hello?
Oh, Ms. Buckley, I don't know about a call.
Of course you don't. Okay. I'll contact you directly then. I was waiting for you to call me, but okay. I will contact you directly.
Well, I can give you my number. My number is not.
Okay. Thank you. I have it. My next question is directed to Freeholder Yardley, and I wonder if you had heard back from Vice President Pence regarding the letter that you read at the last meeting.
Nope. At this time, I have not heard back from President Pence, but I was advised that in the second round we would be getting some funding. I'm also intending to contact.
Thank you, Freeholder Yardley. I heard that. I was just wondering if you heard back. Thank you. My next question is regarding testing. Is there testing available for asymptomatic residents? Yes or no? It's to anybody who can answer.
No, there is not.
Okay, thank you. My next question is, how many COVID-19 cases are there in Green Township? The paper lists, today's paper lists 15.
Give us a minute. We'll look it up for you if you just give us a minute.
Okay. And my next question is going to be directed to the lady that was speaking on behalf of JCP&L, Ms. Spinoza. I wonder if JCP&L could waive the $4.50 fee, which is required if you pay your bill by credit card.
I don't believe she's still on the line. You may have to call her direct.
Okay. Do you have a number for her?
The number to JCP&L is what, 1-888?
Okay, I have that number, and I would ask for, what is her first name? Do you recall?
Jackie. It's Jackie.
Jackie?
Yes.
Thank you. Okay, so the only other question is in regards to the cases in Green Township, the COVID-19 cases.
Okay, we're almost working on the computer to get that for you. So, how you doing, Frank?
Okay, that's it.
It's 8. It's 8.
8, not 16. Okay,
8.
8, not 16, is listed in today's New Jersey Herald.
Now, can I just say something to everyone about these numbers, because it is so difficult. It's not just the county that puts information into the surveillance program that they use. It's labs, it's the state, it's a lot of people. So we may get a number, And then as we go through it, we see there's duplications, or we see that that person doesn't live in Sussex County, so that number changes. Plus, we take our numbers at midnight the day before we report. The state takes their numbers at 1 o'clock the day they report. So there's a difference. Within an hour, there could be a difference. So you may see different numbers, and that's the reason why. They haven't been confirmed, or they've been confirmed, and after the nurses investigate them, they have to pull a couple out.
Okay, so basically you're saying then that we cannot rely on the numbers that are listed in the New Jersey Herald.
Yeah.
I don't know where they got their numbers from. That was
Sylvia,
as of today?
Yeah,
Herb,
Sylvia,
go ahead.
this is, yeah. Listen, if according to the New Jersey Department of Health, the number is 8, and that's from 01/01/22 to 4/21/2020. And I believe my understanding is that we are now using the state numbers.
Yes.
So that's the most current number for your town.
Okay, I just, it's just kind of frustrating because I get the numbers from the newspaper, and, one day it was 4, the next day it was 14, today it's 16, so it just, it would be nice to have something a little bit more accurate that's printed in the paper.
If you go on NewJersey.gov and look up their dashboard, there's numbers there. Take their numbers.
Miss Buckley, I have that phone number for you. Are you ready?
Okay, for who?
Miss Espinosa at JCP&L.
Yes, I do. Thank you.
Area code is 973.
I'm sorry?
The area code is 973.
Right.
300.
Okay.
2929.
Okay, thank you very much, and thank you for answering the other questions as well. That's all for me.
Okay.
Well,
our
excuse
next
me, Ms.
caller
Buckley.
is Lauren Cochler from Sparta. Lauren, are you on the line?
Terry.
Yes.
Terry,
It's
excuse
Lauren
me.
One moment, Lauren. I'm sorry. Yes?
This is Freeholder Hertzberg. I just wanted to respond to Ms. Buckley. I guess Ms. Espinosa was trying to answer and she didn't get to, but she wanted me to relay that the $4.50 service charge is actually from the credit card company or from the third-party payer. It is not a JCP&L charge.
Yes, I'm aware of that. However, that seems like an excessive fee when, if you go and pay with a credit card at most other vendors, you need to spend a minimum of $10 usually. And, I pay my phone bill without any additional charge using a credit card. So it just seems like the $4.50 fee is excessive, and I wonder why that is.
I don't know the answer to that. I was just passing on the information.
I'm sorry?
I said I don't know the answer to that, but I was just passing on the information.
Okay, thank you. And who's speaking?
That was Freeholder Hertzberg.
Okay, thank you, Josh. Thank you for the phone number. I'll get in touch with Ms. Spinoza. That's all for me. Thank you.
All right. Our next caller is Lauren Cochler from Sparta. Are you there?
Yes, it's Lauren
All right.
Collier.
You're beginning now.
Thank you. I want to thank the Freeholder Board for your comments. They were moving, informative, and compassionate, showing your commitment to the community. And as you reported, efforts to flatten the curve are working in Sussex County, and I couldn't agree with you more that our health recovery obviously is so important in the state of New Jersey, but I believe that cannot happen mutually exclusive of the economic recovery. And I was just curious, as you're finding that locally there is a need, and you've stated there's a need for more local involvement, more local control, and some of these things where our hands have been tied in terms of funds or being able to make the decisions necessary to protect where the state maybe should have stepped in sooner. And I'm curious, just in these meetings with the mayors and everything that's going on, if you are feeling like you are getting answers from the governor's office, and if not, how the constituents can be more proactively involved in that. And additionally, just do you
do you see any pathway for Sussex County to begin opening parks, recreation, and business, perhaps prior to the rest of New Jersey, because we have shown, as reported by Atlantic Health, a plateau from the apex, and I'm just very concerned about recovery if we solely focus on no cases. And then finally, I just want to applaud your efforts for the testing. I was able to get tested privately myself, thankfully negative, by going out of county, but I also wanted to emphasize just the need for, as we wait longer for testing, for antibody testing. And since our county has had to wait, I'm curious if that is something that we can begin shifting to see what the true amount of
1 minute
long-term immunity that we have in our community to be able to get back to work. So thank you all for your commitments. I appreciate your tireless efforts.
I'd just like to answer that, if you don't mind. There's a couple of things I'd like to say. We as a government agency, have to follow the governor's executive orders. However, we do advocate for the people in all of these issues. Right now, there is a big concern over our businesses. The fact that the first flow of stimulus money was put through the HUD department, and Sussex County never does well with HUD qualifications. So there were 4 counties out of all of New Jersey that received 0 funds out of that stimulus money. And then what happened when they released the payroll protection plan, which was supposed to give grants to our business owners, we had banks that were not approved by the SBA, so they didn't receive the money. And by the time those business owners were trying to find another bank that would handle them, the money was gone. So we have business owners in Sussex County that are suffering. They're suffering financially. They're suffering from anxiety because if this remains closed much longer, they are not going to be able to reopen. And they're fearful that their lifelong investment is going to be gone. So I agree with exactly what you're saying, but we can't go against the orders, but we do advocate for our businesses. Now, Deputy Director Dawn Fantasia was talking about our Chamber of Commerce and our Economic Development Partnership. Our Chamber of Commerce is working for all businesses, even non-members of their group. Our Economic Development Partnership is putting out a survey to get all the names and all the information from these businesses that need help and what areas they need help, and then we start working through those different groups. So there's all different groups and agencies within the county that are working for the people. I just wrote a second letter the other day to Alice. Well, I wrote to the DEP about the closure of the parks. And interesting enough, I did get a phone call back. And we had a very good phone call to help her to understand how the uses of our park affects the people in Sussex County. So she said that she's heard a lot from all of us, and they're going to be evaluating that. So we hope that all the pressure we put on, not just from the county, but from the municipal government as well, and from our assembly and from our state representatives that are always with us working to help and to find ways right now to get stimulus money to us. But of course that stimulus money is federal, so we need our federal representatives to start working for us and to make sure that whatever agency has money flowing through it, that we will qualify within that agency to receive those funds. So I hope I answered your question.
Thank you. I appreciate it. It's very helpful.
Director
And
Patillo,
Sylvia-
I have.
Yes, wait a minute,
I have
Josh. Hold just a minute, Josh, please.
Yeah, I just wanted to, she also commented on the antibody testing, and I think that's an important point. And I just want to say that you've seen New York has come out and talked about that a lot, and the state is being very proactive in trying to get these antibody testing. And I think, I'm hoping, and I know that we'll apply as much pressure as we can, and I do hope that everybody does to the state to try and be proactive in getting the antibody testing, because I think that will be a big part of getting our economy restarted and getting people out there again.
Is there any other freeholder that wants to speak on that?
Yes, regarding testing, in Freeholder Fasano's report, he did correctly report that asymptomatic testing was happening There was a statement released from the Monmouth County Prosecutor's Office earlier today that said there would be testing for residents without symptoms. However, about an hour ago, and this is all fluid and it's coming through as we're in this meeting, Governor Murphy said the state first needs to obtain a waiver from the federal government before we are permitted to test asymptomatic patients. So just to clarify for that, I know when a speaker has come up and said, was there asymptomatic testing available? We responded back, no, and I want to clarify for you why we said no, because in the time Freeholder Fasano gave his report and where we sit right now, that has been pulled back and we have to wait for the federal waiver, and then we'll be able, the governor's office, I assume, would let us know whether asymptomatic testing would be taking place in the state.
And do you think
Thank
that
you, Dawn.
testing will be, do you think that testing will be available at County College of Morris?
For asymptomatic, I couldn't say either way right now. Again, for me, to be honest, I'd be surprised if they were doing asymptomatic testing even at these two FEMA cooperative sites, simply because in Sussex County, we are still trying to put together our testing model specifically for our county with the proper materials that we need for severely symptomatic patients. So, I don't know whether that weighs into it or the supply chain federally, if they need to weigh in on that. I would think logic would tell me that those tests and those supplies would first be prioritized for those who are, exhibiting symptoms of serious illness.
Yes, but you said there were only 38 people from Sussex County that were tested at CCM. So, I mean, it seems like there's a lot more room for testing, and, it would be nice if it were available to asymptomatic residents, because some of us may have had the virus and didn't have severe symptoms, and, we might be carriers.
Correct. And again, I think time will tell that. And being that the Morris County site is new, we're unfamiliar with whether or not the actual system for registering, if the requirements for testing, if any of those, the distance alone, if any of those were an impediment to people who are feeling seriously ill in the county, did not make that trip to CCM. So again, being that it was just launched, I'd be very interested to see, what direction it goes in. But again, we're not the medical professionals. We're going to take our guidance from where the state tells us to go with our testing model.
But you still need a doctor's recommendation or script, correct, to be tested there? To be tested at CCM?
Currently, yes. At present day, yes.
Okay, thank you.
Yeah. Well, I'd like to say is, oh, go ahead, please.
No script.
No script?
I'm sorry, who's speaking?
I don't know. Who said that? No scripts. All right, let's move on. Prescriptions are required for Sussex County residents if they want to be tested at Morris County facility. But what I want to say is things change quickly. I mean, Dawn Fantasia has been saying this is a very fluid situation. Things change very quickly, and just, keep informed as to what's going on. Call our hotline if you have a question so that we can give you the correct information and the answers that you need. Okay, next, Terry.
Our next caller is Zoe Heath from Vernon. Zoe, are you there?
I'm here, thank you.
All right, your time begins.
Thank you. I'm actually really glad that Freeholder Patillo brought up the parks, because that's what my question was pertaining to. The county was alerted on March 29th about what was going on at Andover Subacute. Then why was the last 2 weeks spent writing letters and petitions and social media posts about the closure of state parks, but not about what's happening at the facility? Especially because saying that Freeholder Yardley was on the County Board of Health for years.
Zoe, there's a million things that we write letters for and we advocate for. We were notified, this Department of Health was notified on March 29th of the first confirmed case. On April 2nd, there was a death. They started at that point writing and calling and doing everything they can to alert the state of New Jersey. Every day they were in contact.
But was any of it done publicly?
Was it done publicly? I don't know how the Division of Health would do things publicly when they're dealing with the state of New Jersey. All I can do is tell you is that's what they were doing. They were contacting constantly. Every time we had someone call, and even if they gave us an anonymous report, that information was sent there. Everything
well,
that
I'm asking about the Freeholder Board. Was the Freeholder Board upfront with the public about what was going on?
We didn't always know what was going on, Zoe, because we were not inside. We were getting numerous reports from a lot of people, and we were sending all of that information up to the State Department of Health, trying to get them down here to go inside. We don't have the authority to go inside.
That's not, but I apologize, that's not my question. It may be a misunderstanding. My question is why it seemed that the focus publicly was about the closure of state parks when technically people were dying.
May I answer that, Sylvia?
Yeah, please do. I don't think I understand the question.
These issues don't exist in a silo. When we're elected to represent all of our constituents who come to us with multiple facets of what they feel is important to them. Some economic, some are health-related, some are mental health-related, and in this situation, that was a significant amount of feedback that we got, that people were concerned about that. So again, there are 5 of us. These issues don't exist in a silo. We often work, many of us have day jobs to begin with, and we often work way into the night to be able to address each and every issue. And a letter was written, not letters, a letter was written by me specifically and shared with the Freeholder Board for approval to send to the governor to ask him to please reconsider his decision. That in no way means that took away the time, the effort, the hours put in to us advocating for Andover subacute. And again, I can't stress enough that these issues don't exist in a silo.
All of the things about the parks, and frankly, the Freeholder Board do not care about mental health issues when they showed triggering footage of people overdosing at one of their meetings, but all of this was done publicly except what was happening at Andover subacute.
1 minute.
My question is, why was there no transparency?
The correct department was in conversation. One Division of Health was in conversation with the State Division of Health. They were the ones taking the lead. We as freeholders didn't have information that they had. They got it on a daily basis. They were the ones advocating. They were the ones pleading.
But no public noise. It's not about departments.
I don't understand what your question is. I really don't understand, Zoe, what you're saying.
Why,
can I just answer
why
this?
Did the freeholders not make this more public?
So, Zoe, this is Freeholder Hertzberg. As soon as the information was made public by the state, we were all talking about it. We didn't have confirmation until they gave it to us. What we had were people calling us and messaging us asking for help. And in turn, we were going to the state, who were the only people that were really allowed to go in this private facility and inspect them. We were asking them to find out what's going on in this place. Tell us what we can do. And we kept asking.
Didn't they know before the state knew?
What's that?
Did Sussex County not know before they knew? I believe that Andover Township Police knew before the state knew. Andover Township to the county of Sussex.
When they went in was when there was a report. This is after we had already called several times asking for them to look into this. Then there was another anonymous report of deaths, which is when Andover went in. That's when it became public. Nobody had confirmation.
So while there were multiple reports of deaths, while there were several anonymous reports,
No.
reports of deaths, it did not.
There wasn't multiple.
Is that what you're telling me?
No, there wasn't multiple reports of death. There were reports of lack of equipment, of patients not being treated correctly, things that people were. It was What's that?
Not alerted that there was use happening here.
I can't hear what you're saying.
I'm asking why all of this was not published.
Because we didn't know what was really going on. We were asking the state to go find out. And once we would have confirmation, then it could be public. But you can't just put anonymous reports out as public information.
With the Andover Township Police said.
When they went in was the first time we had confirmation of anything.
Is that time?
That is time, way past time.
Okay, thank you very much, Zoe.
The next caller is Doreen Edwards from Vernon. Doreen, are you on the line?
Yes, I am. Good evening, everyone, and thank you for holding this teleconference. I find it very informative, and actually it works out best for me because coming from Vernon and I'm going over to Newton on certain nights where the meetings run hours and hours, having a health situation, it gets very hard for me to stay and to do public comment if the item is not on the agenda. So I actually am very appreciative of these calls. One of the questions was asked and answered about testing, so I'm not going to ask that. The other thing I just wanted to mention is that personally I have seen quite a few accidents around town. Actually, there was a fatality today at the end of Cannister Road 23 intersection. And I have a brother that I have to help that's disabled that I have to drive to Bergen County on occasion. And I have just noticed on the roads, this is just a comment, that the people who are out there driving seemed even more distracted and are definitely driving way too fast. I don't know if it's a nervous reaction to what's going on or what, but it just seems very, very noticeable. While I was sitting in traffic heading home today to get off on Cannister Road, had my window open, happened to be talking to the gentleman on the next to me in the car, and we got to talking about the same thing.
They could test everyone in the country tomorrow, and the number could be like 3 times as much as the highest day.
Okay, please, we have one speaker that's on the floor, please. Would you please let her speak?
I don't know what that was in reference to anyway with the testing. I was talking about the driving situation. So I don't know. I don't know if you could put something out there and just as a reminder to the citizens, under these very difficult circumstances, please pay extra attention. Put your phones down, take a deep breath, and drive within the limits, please, to save additional lives. Because as I said, there was a fatality today. And I left at 12:30 in the afternoon, and I came back at 4:30, and the 2 vehicles were still there. And a bunch of police vehicles and whatnot. And the last thing, if you don't mind, May is National Lyme Disease Awareness Month. If there's nothing on the public site, the health department site, can they put something on about that as well, please?
Okay.
And that's it.
Thank you very much, Doreen.
Thank you.
Your next caller is Sonia from Sparta. Sonia, are you there?
Hi. Yeah, I'm here. Hi.
All right, you're starting.
Yes, thank you. My mom is a patient in Andover 1 who has the COVID-19 virus. Needless to say, I am very sad, very angry, and very worried. The articles that come out every day are much worse than I would have ever anticipated. However, I had a feeling that things weren't going well in early April, as far as shortage of staff and equipment. I reached out to the state government and to the county, and frankly, didn't get very far. I did reach out to one of the freeholders and had a number of conversations. And this freeholder, I'm not going to name, but they could speak up. They know who they are. Was very helpful, very sympathetic, and not at all patronizing, which a lot of the departments were very patronizing, frankly. I was assured that there was nothing wrong with Andover or any of the other nursing homes in Sussex County. Okay? If the freeholder wants to raise their hand, they can, and because I am patting them on the back.
Well, thank you, Sonia. It's Josh, and I told you can call me anytime.
Thank you. Yes. There's a lot of blame to go around in this situation. I'm not getting into that right now. But I do have a concern. So the state government came to Andover, state issued citations Andover has to now hire 3 positions. What exactly does that do for my mom right now and the employees who are barely making minimum age, that are barely getting by, they are dying, and they're sick? What exactly do these 3 positions do? And how is that helping to take care of mom right now that is in isolation? My other comment is, and maybe somebody knows the answer, excuse me, is so the health department,
1 minute.
the state health department, is that also the department that issues licenses to nursing home owners? And why was this person even issued a license when he has some very, very questionable business practices in the past related to nursing homes? Is that the same department that's been up here? Does anybody know the answer?
Yes, it is the state health department that licenses the homes, yes.
And now they're also doing the overseeing and citing the owners. I think that is a huge problem in the state of New Jersey.
I agree. And I think that's the thing we have to point out to the Attorney General when he has his investigation. Those are the questions that we should be asking.
And that I don't know what the outcome will be with my mom, but I will not go away on this topic.
Good.
Your time is up.
Thank you. Thank you.
Thank you, Sonia.
Our next caller was, I'm sorry, I can't read my own penmanship. Is it Michael or Michelle Van Allen?
Michelle.
Michelle, I apologize, from Hardiston. You can start now, Michelle.
Okay, thank you. I had to unmute my phone. I want to state that anyone in position of being within our government should be appreciated and thanked for all that they do to help us, each and every one of us here, especially our frontline workers, our medical professionals, and people that keep our community fed. I just want to address Mr. Yardley and Ms. Fantasia's comment about a very negative thing. They said that the state of New Jersey is doing an appalling job, and it's a shame that they're openly stating that to everybody that's trying to do their best right now to handle a problem that we've never, ever faced in the history of our lives. So at this time, pointing fingers directly at them, well, when you point fingers at somebody else, 4 more point back at ourselves. The Andover Nursing Home is in our county, and the Freeholder Board has been in control by the Republicans within Sussex County for decades. These problems did not crop up in the last couple of months. Knowing that the COVID-19 spread was growing, perhaps the county should have taken the initiative to help protect the staff and patients faster. So I don't know when the county started providing PPE, but hopefully it wasn't after it hit the press, because someone had to be aware of it somewhere along the way. I'm here. Can you still hear me? Hello?
We have a caller on the line. Michelle, please continue. I'll give you additional time.
Okay. And by the way, the President of the United States did not act quickly enough to mitigate this problem in January like he should have, and maybe the New Jersey government would have been able to get this under control much faster. Governor Murphy has gone above and beyond to do everything in his power, especially without the proper cooperation from the federal government. Then please, everybody that's listening or hearing this, or even the Freeholder Board, remember that when you all vote in November. And you say that our legislative district representatives have been working for us. Perhaps Senator Arho might be actively working on this situation, but people like Parker Space, who were touting the virus as being a hoax until very recently, you need to address his behavior. And the Tea Party trying to get the state open back up by open protest is not a solution, nor is it helpful. Wanting the state parks open because they wanted them open, we would all like that. But the reason was because people would not adhere to the rules, and parks had to be closed statewide, not just in the most populated areas, to protect us all. Please take some responsibility for whatever the county administration has in this situation. Sussex County residents deserve what we need and what we're entitled to here, but our representatives for LD 24 need to work harder to get us what we need here. The freeholders have the power to request that from our legislative 24 representatives. And holding bonfires on Space Farms property for Tea Party protesters breaking the law against social distancing is not exhibiting good leadership or elected officials that we can count on. So when everybody starts pointing fingers at who they think is responsible please look in our own backyard. I'm not saying that Andover Nursing Home is the fault of the county administrators or freeholder board, but someone had to be aware somewhere along the way. And it's easy to turn and point to the Democratic administration in the state. However, Governor Murphy has done an exemplary job of stepping up and taking care of a problem that no one could have expected, foreseen, or known how to handle. It's trial and error as we go along, just like for you guys. It's the same thing for Murphy and his administration. And the fact that he has been able to help plateau the curve
Van Allen,
right now.
your time is up. Your time is up, Ms. Van Allen. Thank you very much.
Thank you for your time.
And I just want to say one thing. This is Freeholder Hertzberg. We are not pointing fingers at a Democratic administration. I don't care what they are. We're pointing fingers at the people who are responsible for oversight of that facility. We're pointing fingers at the people we were asking to come in and help. That whole statement was very political. Nothing about this has been political from us.
Sylvia, Patillo, please, may I speak here also?
We have to count on our politicians to do the right job, Mr. Yardley.
We have public comment open, and the 3 minutes are over, and now the freeholders are free to address back to the callers, just like if we were in a live setting, how that works. So, again, as Freeholder Hertzberg said, you can call it finger pointing all you want. I call it accountability. The county, to address what the first gentleman spoke about, the county has limited jurisdiction over a private facility. The state of New Jersey is the only entity that could go in and intervene to take over, per se, the facility. As far as inspections go, like I mentioned, Camden County took that responsibility and is doing local inspections now of the facility, taking over for the state because the state was ill-prepared. And this is not political because Camden is a very Democrat-represented area, and the current state administration is a very Democrat administration. So I do not entertain any of this political nonsense because it's not political. The lady who just spoke about her mother and being concerned about her mother, she doesn't care whether you're an elephant or a donkey. She wants somebody looking after her mother. So it's not political. When someone dies, if somebody says, oh, but I did my best, your best isn't enough. And this New Jersey Department of Health's best was not enough. Maybe our best was not enough in putting enough pressure or intervening. I don't know that answer. Because, again, the day-to-day operations, we receive information, we report it to our health department, we make phone calls. Senator Oraho, I can speak for him directly on this piece, is actively involved every single day, borrowing, and stealing PPE to try to get it up here for us, contacting the state police on this issue. This was a cooperative effort that is coming too late. And again, when the female speaker before said, how are these 3 hires going to help my mother? My answer is, I don't know, because I'm not a medical professional, but what I do know is that the governor has mentioned perhaps sending in the New Jersey National Guard and some of their medical team, and that would help, because that would be more staff and adequate staff to make sure that we don't hear situations about individuals that are dehydrated and not being fed and suffering. So that's first, is adequate staffing in that facility. It is a private facility that is supervised by the state of New Jersey, period. And it is our job to hold their feet to the fire when our county is being overlooked.
This is Freeholder Yardley. Hello?
Yes, Herb, go ahead. Speak, please.
Thank you, Josh and Dawn, for making those statements. I think what everyone forgets on this issue, we are dealing with people's lives. And one of the things that the health department does is to help and provide a safe environment in those things by which we can control. This nursing home was controlled by the state of New Jersey, and they were supposed to be inspected by the state of New Jersey. We have not received any of those inspection reports, and I'd like to see what they look like, to see what was being said and how often they were inspected. And that is going to tell the tale of whether or not the state did their job. The state did not report any deficiencies to the county. They didn't call up, as far as I know. They didn't call up this year, they didn't call up last year, and they didn't call the year before that. And I take umbrage to the fact that we're going to say how great the governor is and how great his staff is. This facility was operated by someone, an individual, and inspected by the state of New Jersey. And if there were problems, they should have been clearly identified. You're telling me nobody from the state of New Jersey noticed there was a problem there? Really? Thank you.
Thank you. Thank you, everyone. I know that this is a very emotional time, and the situation that we're dealing with is devastating to everyone. I will just end this comment period with saying that the governor did tell us that the Attorney General was going to do a full investigation, and wherever it falls, the blame falls, it falls. Those were his words at his conference on public national TV. So that investigation should give us a lot of the answers that we're looking for. So I just want to thank everybody for speaking their heart and speaking the things that they have probably held in for the last couple of months. And I would like now a motion to close the floor to public comments, please.
So moved, Hertzberg.
Is there a second?
Second, Anthony.
Okay, thank you, Anthony. Is there any discussion? Hearing none, all in favor, please signify by saying aye.
Aye. Aye.
Okay. All right, now we're at 23, and before we go on to executive session, I want to remind everyone to turn to the county's website at www.sussex.nj.us for any meeting schedules. That is the end, right? Let me just check, right? Okay, I would just like to make a statement before we go into executive session. The county is transparent and releases information to the public as soon as it is confirmed. Tonight we are having an executive session to discuss matters concerning a COVID-19 update and status report. The Open Public Meetings Act requires that all matters relating to public safety and property and matters required by law to be confidential must be discussed in executive session. Terry, would you please read so we can move on to this, please?
Certainly. Whereas the subject matters about to be discussed may be excluded from the public portion of the meeting by resolution of the Board of Chosen Freeholders as an exception to the Open Public Meetings Act pursuant to NJSA 10:4-12B, and whereas it appears necessary for the Board of Chosen Freeholders to discuss such matters in executive session, now therefore be it resolved that the Board of Chosen Freeholders of the County of Sussex, in accordance with the provisions of NJSA 10:4-12B and NJSA 10:4-13, that the Board at this time enter into an executive session from which the public shall be excluded, and be it further resolved that the general nature of the subjects to be discussed relate to the following items authorized by NJSA 10:4-12B as designated below. Number 1, matters required by law to be confidential, subject COVID-19 update. Item number 6, matters relating to public safety and property, subject COVID-19 update. Be it further resolved that the deliberations conducted in closed session may be disclosed to the public upon the determination of the Sussex County Board of Chosen Freeholders or provided by law that the public interest will no longer be served by such confidentiality, and be it further resolved that upon the completion of the business for which the Board has entered into the executive session, the Board shall not reconvene and resume its meeting to the public. Be it further resolved that the Board expects not to take formal action after executive session and will adjourn the meeting in executive session.
Thank you, Terry. Before I ask for a motion, I just would like to thank everyone for being on this conference call and speaking openly to all of us. At this time, I would ask for a motion to adopt the executive session resolution and enter into executive session.
So moved.
Hertzberg, so moved.
Okay, I have a second?
Hertzberg, second.
Okay, thank you. All in favor, please signify by saying aye.
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 Okay. We are in executive session, so thank you very much to everyone.
We will now conclude with this conference call, and Freeholders, you have your next conference platform information.
Okay, thank you, everyone, and please be safe. Take care of yourselves. Thank you very much.